Just remind.
You have already reminded.
Yeah. Class rep had
Oh,
remind us.
okay, then no problem. Okay, so this is like our last topic, urinary function and dysfunction. Okay, so in the content, if you see, they have given very lesser time as well as lesser importance to this particular topic. But I will be taking this particular topic little deeper because like you have a lot of patients in urinary incontinence, especially in Malaysian hospitals. And not only that, like apart from the other cases, maybe only the females will be allowed to see the patient, but this particular case, like even the male therapist will be allowed to see the patients. So that's why we give little more importance to this particular topic. Okay, so if anybody is there in the uh, if anybody is there in the waiting room, just let me know. Okay. So here in this topic, we will be seeing about what is the normal function of micturition, or how the normal urinary voiding and unvoiding takes place, and what is the problem of affecting this particular cycle. Then what is incontinence and its types and its PT management. So overall, first of all, if you see the anatomical function, so everybody will be having two kidneys, so one on either side. So we will be having two kidneys, and the kidney will be the main function of the kidney is to undergo filtration. So it is same like our coffee or tea filter. So it will be filtering the blood, and all the unwanted materials will be collected, and that will be stored in the bladder. Okay, so how this kidney functions means it will be having a lot of cell called nephron, and the action of this nephron is to filter the fluids. So it will filter the fluids, and all the unwanted minerals, vitamins, or like even the salt or anything, everything will be collected and it will be sent to the bladder. So after filtering, the unwanted products will be sent to the bladder. So the bladder is over in the pelvic organ. It will be there down through the urethra. Through the ureter. So the function of this ureter is to collect the unwanted materials from the kidney and to bring it to the bladder, and it will be bringing in a form of a droplets. That means like it will come like a drop by drop. So it will get filtered and it will be coming like drop by drop. And so after coming to the bladder, so the bladder is a very smooth muscle. Smooth muscle means it is like a balloon. So it will be in a very shrunken form. As the fluid is coming or unwanted materials are coming, it will be getting collected in the bladder. So it will become bigger and bigger. So like a balloon, how you will be blowing the air, same like that, the bladder also will blow up. And this bladder is made up of smooth muscle, and not only smooth muscles, it will be like an elastic in nature, and it will be having lot of reflexes attached. So as the bladder increases in size, the stretch muscles will be sending out all the reflex to the brain, and the brain will be deciding whether to void or to defer the voiding. So this is what happens. Okay, so as the bladder keep on increasing, it has certain capacity. After that, it will be keep on giving a stretch reflex to the brain, and the brain have to decide whether to void or not. So that is the function, that is what is happening in the urinary organs. So this is same for both men and women. It is not like different. Only the structure will be little bit different. Structure in sense, till the bladder, every structure will be same. After the bladder is having three holes two at the top, two for the entering of the ureter, and one at the bottom, that is called urethra. So urethra is a tubular structure that will be letting out the urine outside. Okay, so the urethra will be controlled by the pelvic floor muscle. So when the pelvic floor muscle is contracting, the urethra will be closed. When the pelvic floor muscle is relaxing, the urethra will be open and it will be sending out the urinary material. Is that clear? So till this urethra, everything will be same for men and women. After this urethra, for a women, the urethra will be continuing and it will be opening up in the just above the vagina, but in men it will be opening up through the penis. So that is the difference between men and women. Rest everything will be same. Okay. So when all these functions happen, if the bladder or if the urinary tract has any infection, then it will be causing some alteration in this particular function. Otherwise, this will be keep on going day and night. So even in the night also it will be keep on going. But only thing is the brain will be controlling this particular activity in the night. So whenever you go for a deep sleep, the kidney also will go for sleep. The kidney will not do any filtration. But whenever your REM starts, REM is rapid eye movement. So whenever you have this rapid eye movement, the kidney also will be functioning. So that's what when you don't go for deep sleep, you need to keep voiding and you will be getting up. So if you go for deep sleep, you won't get up in the night. So this is because of the control by the cortex over the kidney. Is that clear? Okay. Then the act of voiding, that means the act of letting out the excretory material is called as is called as micturition. Okay, so the act of letting out of excretory material from the rectum, it is called as defecation or passing motion. Okay, so this maturation, it's a cyclic process and it has two phases. One is bladder filling phase, another one is bladder emptying phase. So filling phase means collecting the materials in the bladder. Emptying phase means letting out all the unwanted product. So this maturation is a cycle. It has two phases. One is filling phase, another one is emptying phase. Throughout the filling phase, the dextrous muscle. So dextrous muscle is nothing but the bladder muscle. So the bladder muscle will remain relaxed and it will be keep on bulging out and it will be storing the fluid. So as the fluid reaches to a certain level, maybe around for 150 to 200, the bladder will just send the first reflex to the brain or to the spine. Okay, so that time you will get the first desire to void, but still you will be able to postpone the voiding. So in case some of the people will see if the situation is favorable, then they will go for void. If the situation is not favorable, then they will again start to store the urine. Okay, so like that it keeps on going. So this complete structure is controlled by the neurological as well as by the muscular structure. So they have a neurological control as well as they have a muscular control. So muscular control is by your dextrous muscle and the pelvic floor muscle. So the dextrous muscle will be keep on bulging to store urine. When it is contracting, automatically the pelvic floor muscle have to control or have to contract and hold or close the urethra. But if it fails or if the pelvic floor muscle also relaxes, then automatically the voiding will happen. Is that clear? So I repeat again, the control of the micturition happens in two phases. One is filling phase and another one is emptying phase. So this control is by the nervous system as well as by the muscular system. So nervous system through the nerves, muscular system through the muscle. Okay, so whenever the bladder is filling, the dextrous muscle will undergo relaxation and the pelvic floor muscle will undergo contraction. Whenever they want to go for voiding, the dextrous muscle will go for contraction and the pelvic floor muscle will go for relaxation. Then only the proper voiding will take place. So this is about the muscular. So we will see a little bit in detail about the neurological control of the continence or neurological control of this particular cycle. So we have three levels of control. So one is spinal level, pontine level, and the cerebral level. So sometimes, like when every situation favors, they will be having the control at the spinal level, and they will just finish it off when the spinal levels. Okay, so but if the situation is not favorable, if they want to again continue for the filling of the bladder, they can't void, then it will go to the pontine level. Okay, if still in the pontine level also, if there is no restroom or if they want to still go for control, then they will go for the cerebral level. Okay, so like this only three levels will be maintained. So we will see a little bit in detail. So if you see the bladder muscle, that is your dextrous muscle, it is a soft muscle, as well as it will be having lot of stretch receptors. So as it is filling, the stretch receptors will be activated and it will be sending the afferents through parasympathetic nerve. So this afferents will be through the parasympathetic, and this will be reaching to the sacral root. Okay, so sacral root is nothing but the sacral maturation center, that is S2 to S4. So in S2 to S4 is the first spinal level, that is the sacral root will be there. So this dextrous muscle will be sending the afferents through the parasympathetic via the pelvic nerve, and the pelvic nerve will take the afferent information to the sacral root, that is S2 to S4. So if the situation is favorable, then the sacral maturation center will send a sympathetic efferents stating that contraction of the dextrous muscle and relaxation of the pelvic floor muscle, so that the voiding will take place. Is that clear? So initially there will be a stretched receptors that will be activated, and that will be sending the efferent information to the sacral root. So that is through the parasympathetic via the pelvic nerve, that will be reaching the sacral center, that is S2 to S4. So if the situation is favorable enough, then from the sacral itself, they will be sending the reaction, that is your afferent, that is sympathetic. So sympathetic will always lead to contraction of the dextrous muscle and relaxation of the pelvic floor muscle, so that the person can void. Okay, but if the situation is not favorable, then the sacral center will send the afferent stating that should not be any contraction of the dextrous muscle and relaxation of the pelvic floor muscle. Okay, so the dextrous muscle will further undergo bulging, or it will further undergo relaxation. So more and more amount of urine will be collected. So first level will reach, then again more and more urine will be getting collected. So when the more and more urine is getting collected, the dextrous muscle will undergo still bulging, and more number of stretch receptors will be activated, and again it will be taken to the sacral center. So from the sacral center, lateral spinal thalamic tract will be taking the orders, and it will be reaching the pontine. Okay, so that means when the sacral root is not able to decide, then it will send the impulses through the lateral thalamic tract, and it will be reaching the pontine level. Now the pontine will be deciding whether to void or to again undergo relaxation. Is that clear? So now the pontine will see whether there is a favorable situation or there is no favorable situation. If there is no favorable, if there is a favorable situation, then the pontine will send a excitatory afferents, stating that contraction of the dextrous muscle and relaxation of the pelvic floor muscle. Okay, but if again the situation is not favorable, then the pontine will send the sympathetic system, sympathetic afferents, stating that again undergo relaxation of the dextrous muscle and furthermore contraction of the pelvic floor muscle. Okay, then the bladder will be like ready to store more amount of urine, and the bladder will be storing more and more amount of urine. So this more and more amount of urine will again stretch the receptors, and again more and more amount of reflexes will be going to the sacral center. From the sacral center, it will go to pontine. So the pontine now will think that it will not be able to decide. So it will be sending the orders to cortex. Okay, so now the cortex will see whether the desirable situation is available or not. If there is desirable situation, then it will go for voiding. If there is no desirable situation, again the cortex will suppress the voiding urge at the subconscious level. How it will be suppressing means it will be again sending a sympathetic afferents through hypogastric nerves, and it will again allow the smooth muscles to undergo relaxation. Okay, this sympathetic or this hypogastric nerve will come and will again suppress the stretch receptors. Okay, again it will suppress the stretch receptors. So when it is stretching, when it is suppressing the stretch receptors, again the dextrous muscle will undergo relaxation, and the pelvic floor muscle will undergo contraction. Okay, so like this only the three the micturition center will be controlling at the 3 levels. Okay, so if the favorable situation comes, then the parasympathetic will be getting again fired, and it will be undergoing contraction of the dextrous muscle. Then the pelvic floor muscle will undergo relaxation. So the complete bladder will be emptied. Is that clear? So the parasympathetic will be leading to contraction of the bladder. Sympathetic will be leading to relaxation of the bladder. So let me, if you want, I can explain again through the picture. So this is the bladder. So this bladder is made up of smooth muscle, and it is called as dextrostar muscle. This dextrostar muscle is made up of lot of stretch reflexes. Stretch receptors. So as the bladder is keep on enlarging because of the storing of the urine, the first stretch receptors will be sending the reflexes through the parasympathetic, that is through the pelvic nerve. It will be reaching, that is your A, it will be reaching the sacral center. So if the sacral center sees a favorable situation, then it will be sending the sympathetic to the bladder to contract the bladder muscle, and it will be sending another sympathetic to the pelvic floor muscle to relax the pelvic floor muscle. So the voiding will take place at the sacral level. But if the situation is not favorable, then it will ask for relaxation of the bladder. So further lot of urine will start to collect. When there is more and more amount of urine is collecting, more and more amount of stretch receptors will be stimulated, and that will be sending more stronger parasympathetic contraction. More stronger impulses will be sent back. Okay, so from the sacrum, this more and more impulses will be carried to the pontine through the lateral spinothalamic tract. So the pontine will decide whether to void or to relax. If it is want to relax, then it will be sending the sympathetic again to relax the bladder, then to control the to contract the pelvic floor muscle. So further again the filling will takes place. Then later again more amount of impulses will be again pushed to the sacral center. From the sacral center it will go to pontine. The pontine will see it will not be able to control only with the sympathetic system. So it will take the orders to the cortex level. So the cortex will be stimulating the spinal cord at T11 to L2 where the hypogastric pulses are there, and that will be again sending the sympathetic to again relax the bladder muscle and contract the pelvic floor muscle. Is that clear? So if the situation is favorable, then it will be sending the parasympathetic to undergo bladder contraction. If the situation is not favorable, then the sympathetic system will be stimulated where the bladder will be undergoing like relaxation, continuously relaxation, and more amount of urine will be stored. Is that clear? So this is the neural control of the peripheral nerve. Neural control of the maturation. So when this nervous system as well as the muscular system is in a good control, you will not have any problem with the maturation. But if there is any problem, or if there is any issue with the nervous system, or if there is any issue with the muscular system, then they will not be able to control this maturation. They will be undergoing leaking. So maybe the person may have some neurological problem, maybe a spinal cord injury. So where if they have a spinal cord injury at the T11 level, then below this everything will not be working. So these people will not have control over the bladder. So they need to have the urinary bag continuously because they don't have this both. Okay, sometimes if the spinal cord injury is lower level, then they will not have problem with this they will have problem with the sacral center. Okay, so in that patients what will happen, they will be having only the this hypogastric thing, so the bladder will be keep on filling and they will not be able to void. So in this case what will happen, if anybody just touches the lower abdomen, immediately this will trigger the bladder muscle, they will undergo complete voiding. Okay, so this is the neural problem. Or if there is any problem with the prudental nerve, so the pelvic floor muscle will not be having proper control. So these people also will will be having leaking of urine. So any system that is affecting any of the nervous control, either at the sacral level, pontine level, or at the cortex level, they will be having this maturation problem. Okay, so in case sometimes what will happen, uh, sometimes only the parasympathetic will be affected, or sometimes only the sympathetic will be affected. So this will happen mainly in any spinal cord, it is not spinal cord lesion, like spinal cord injury, like myelin sheath disorders and other problem where the nerves, there is the sympathetic and parasympathetic nerve will be affected. For them, all the other will be under control, but they will not be able to void properly, or either if they are voiding, they will be continuously voiding. Either if they are controlling, they will be having continuous control. So any neurological deficit will lead to problem with maturation. This is one side. Another side, if they have any muscular problem, so mainly the muscular problem, there are sometimes the dextrous muscle might have problem. So might have problem means So if any a mild pressure over the dextrous muscle, then the dextrous muscle will suddenly undergo contraction, and even the pelvic floor muscle will not be able to hold it, so it will just leave out. Okay, so sometimes some people, if you just touch the abdomen, lower abdomen, they will just void it like kids. They will not be able to control it. Okay, so another problem is if there is problem with the pelvic floor muscle, any weakness in the pelvic floor muscle, then also they will have problem with maturation. They will not be able to control. They will just leave out. Is that clear? So any problem with the muscular or any problem with the neurological control, you will have problem with the maturation. You will undergo leaking. Okay. So there are some other factors apart from this neurological, apart from this musculoskeletal. There is some other factors which will be controlling this normal urinary function. That is, if there is any structural sound healthy problem, then if there is any damage or pathological problem to the bladder, then they might have this particular problem. That is, if they have if they have any tumor inside the bladder, if they have any pathology in the urethra, like any tumor or any scar tissue or any other infection, then also it will be affecting the healthiness of the maturation. They also will undergo problem. For example, if they have a tumor inside the bladder, what will happen? The dextrous muscle will be continuously feeling. The dextrous muscle will not know whether it is fluid or whether it is a tissue. Okay, for the dextrous muscle, anything that leads to stretching of the muscle, that will be keep on sending the reflex. So the bladder, even though if it is empty, if they have any tumor inside, that the dextrous muscle will keep on sending the reflex, and the people will go to voiding. They will feel as if something is there in the bladder, they are not able to void, so they will be going for micturition many times. Okay, like they will go to the toilet, they will only have drops of urine, then again they will come out. Even when they are coming out, and they will feel as if something is there in the bladder, they won't feel the bladder emptying satisfaction. Okay, so this is a factor that will be affecting your normal maturation. Another thing is like any nerves. The nerves, already we know what are the problems. Okay, if there is any problem with the nervous system that is supplying to the bladder, urethra, or pelvic floor muscle, then again it will be affecting the maturation. Then another thing is the bladder position. So normally the bladder is positioned in such a way that it has a pinch cork effect. Pinch cork effect means you would have seen in any drinks, alcoholic bottle. So they will be closing the bottle with a cork. So if you want to pour out the alcohol, you have to tilt it in a particular angle. If you are tilting completely upside down, there won't be any drops coming out from the bottle, because the cork will be closing the mouth tightly. So this is called pinch cork effect. So same that kind of effect will be there in the pelvic cavity. That is, the bladder is positioned in such a way that any pressure in the abdomen will not affect the bladder. That means even though there is lot of pressure like coughing, sneezing, so the increase in the abdominal pressure will be going and hitting the bladder. But even though if it is hitting the bladder, there will be a pinch cork effect over the lateral aspect of the bladder. So this will lead to further closing of the urethra. So there won't be any leakage there won't be any leakage, and the complete the continent level will be maintained. Okay, but if the bladder is mispositioned or it is pushed up, so usually during pregnancy, the bladder will be pushed to a side. So that kind, or because of any other pathology in the pelvic organ, the bladder will be pushed to one side. So if the bladder is repositioned in some other area inside the pelvic cavity, then this pinch cock effect will not be there. Whenever there is increase in the abdominal pressure, automatically all the pressure will be over the bladder and the bladder will just open up or give up. So the complete urine will be voided. Is that clear? So this is the third factor. Fourth is the bladder size and capacity. Normally some people will have a smaller bladder. Okay, so congenitally some people will have a smaller bladder and congenitally they will be, the size and capacity will be less. So those people will undergo maturation more often. When they undergo maturation more often, automatically pelvic floor muscle will get irritated and the pelvic floor muscle will undergo the pelvic floor muscle will undergo weakness. Is that clear? Okay. If there is any pathology in the surrounding structure, that means if there is any pathology in this outside the bladder, if there is any pathology like tumor, fibroids, and other thing, so normally the uterus will be it will be in a very shrunken position. Only during pregnancy it will bulge out. But if the uterus has fibroids, then it will be little bigger size. So the bigger size will compress the bladder continuously and that also will lead to problem. Okay. Then another is, so these are the factors that is there present inside the body. Okay. If the problem is outside, like the patient is not able to get up and walk, the patient has very severe knee pain, so she is not able to getting up and walking. Okay, so the patient has arthritis, maybe rheumatoid arthritis or osteoarthritis. The patient is finding it very difficult to get up and walk. So even though if they have the favorable situation, like for example, the bathroom is next to the bed. So by the time she gets up and walks to the bathroom, she will void. This is because they are not able to walk to the bathroom at a particular speed and reach the bathroom in time. Okay. Some people will have arthritis and have problem with the deformities in the hand. So even though if they go to the restroom at proper time, they will not be able to undress themselves properly. So they also will have this particular problem. Is that clear? So they may not be able to open up the toilet properly, toilet knobs properly. They may not be able to reach or open the bathroom. Sometimes they reach the bathroom, somebody else are there inside the bathroom, so they are not able to hold. So these are some of the external factors which will be affecting the maturation. Is that clear? Okay. So we saw like maturation, it has another name that is called as continence. So the normal ability of a person to store the urine and the fecal material temporarily with conscious control over the time and place of maturation and defecation is called as continence. So continence means the person will be having ability to control or hold the urine and motion. With the situation favorable like place and time. Okay, the person who doesn't have this control is called as incontinence. That means some people will have incontinence inside the bathroom, that is different, but if they have this incontinence outside, so socially like unacceptable places, then it is called as incontinence. Okay, so that means a 1 year child, if it is goes for urine in the bed or in the room, then it is not incontinence. Okay, but same thing if 10-year old child is going, then it is incontinence or it is a problem. Okay, so maybe I'll give you some 5 minutes break before going to the next part of the subject. So far we have just seen the anatomical and physiological control of the bladder. Now we will be going into the actual topic, our urinary dysfunction. Okay. So class representatives, please let me know who were absent. I think nearly 6 of the students are absent. So the time is around, I think 9:20. Okay, the time is around 9:20, so we will get back by 9:25. Okay. Okay, so can we start? Hello, are you all there? Students, can you hear me? Hello, can we start?
Okay, miss.
Sorry for the internet issue. Since the whole country is going online, the internet is very unstable. Okay. So far we have seen what is continence and what is incontinence. And for continence, what are the factors that is responsible to hold it, and how to, if the factor is affected, then how it is affected. Okay, so that's what we have seen. So now we will see like what are the types of incontinence and how to differentiate the incontinence, because if you don't differentiate the incontinence, you will not be able to give them the correct treatment. So we need to differentiate the incontinence, and not all the types of incontinence can be cured by physiotherapist. Okay, so that's why we need to differentiate and identify the type. Then how to assess, then how to do the exercise. So the first is like, so incontinence, we know like there is a little amount or a complete loss of urine without considering the environmental factor, and without considering the sociological factor. Okay, so that is called as incontinence. So urinary incontinence means the incontinence or involuntary leakage of the urine, that is called as urinary incontinence. In the other side, if it fecal incontinence is uh, leakage of the feces, so that is called as fecal incontinence. Okay, so those are those are that is the difference. And this incontinence can be like very less or maybe very severe form. Okay, so it may range from a very lesser amount to a very increased amount. Is that clear? So maybe a few drops to sometimes very like the complete voiding will happen. Sometimes it occurs very frequently, sometimes it will occur very rarely. So these are the difference. So overall, if you see, this will be affecting more both men and women. It is not that it is affecting only women. It will be affecting both men and women, but the prevalence rate is little higher in women. Okay, so the prevalence rate is little higher in women compared to men. Then, if you see in Malaysia, the rate of incontinence, the rate of prevalence of incontinence is more, but mainly it will be unreported. In European countries, it will be reported more often compared to our Asian countries, because most of the Asian people will have lot of misconception about this particular problem. So that will be in, and that's why it is underreported. But globally, if you see, the prevalence of urinary incontinence ranges from 3 to 53%. 3%, the lesser percent are in the Asian countries, because it is mostly underreported. So why they are underreported is they think that is a normal aging process. So it is normal to have incontinence in the older age. So that is the concept of most of the Asian population. Another thing is it is common in women. So that is another misconception the women's are having. So these are the conception. Then because of fear, because of unawareness of the effective treatment, they don't know that there is a treatment for this particular problem. So all these things will lead to will lead to underreportedness of the particular problem. But there are more cases in all over the world, especially in Asian countries also there are more number of cases. Okay. Are you able to hear me properly? Are you able to hear me?
Me sorry, just now can't hear. Just like lagging. But then just the seconds before miss you asked, it's really can't hear.
Okay, now it is you are able to see the picture clearly.
During this slide the prevalence still get a bit blur, not HD,
Okay.
not really clear.
So, if you see, this is a normal picture of the cross section of the pelvic cavity. So, the bladder, the uterus, and the rectum. This is anterior, this is posterior. So, same thing in men, if you see, they will be having a bladder and the rectum. So, down, if you see, the pelvic floor muscle is the lower part which is controlling all three opening. So the urethra, the vagina, and the rectum. So all three opening, or the anus, all three opening is controlled by the pelvic floor muscle. So same here, even in the men, the pelvic floor muscle will be controlling the urethra, then the anus. Is that clear? So if anything happens here or any pressure comes over the bladder, immediately the pelvic floor muscle have to contract and hold the continent level. So that is the basic concept. That is the normal thing that is happening in everybody's body. Okay, so when this normalcy is affected, then only you will have problem or you will have incontinence. Okay, so we have many types of incontinence. The first is extraurethral incontinence. Just a minute, let me change and see.
Miss,
Yeah, let me change the connection and see. Is it little better?
Miss, wait, yeah. The screen's still sharing. The screen is a bit blur lah. Not really clear.
See how it is now?
Same, Miss.
Same. Now, now how it is?
It's okay. Maybe just continue because the screen is a bit blur, but I still can read lah. Just
Okay.
the main problem is sometimes Miss when Miss talking is lagging. It's really cannot.
Oh, okay. Actually, like when the whole campus is using only two connection, either they will have their personal TM connection or our AIMS TM connection. So when everybody starts to use, the speed is coming down. That is a problem.
Is maybe you can buy a modified modem. A modem that you can use the 4G SIM card.
No, already I have changed because like in between it was not at all, like it was very slow. So I have changed and I have changed to another one.
Also using TMS.
Yes, TM only. The basic problem is our campus connections are, that is the connection switchboards are very very old, it seems. So they are not able to give optic connection to us. Even if we are paying for optic fiber connection only, but they are not able to give really the optic connection speed, because from the gate the wire whatever is coming to the switchboard is very old. That is a basic problem. Okay. So can we continue the class or you want to stop?
Can continue, Miss. Now it's more clearer.
More clear. Okay, so we have many types and we want to differentiate the types, because not all the types will be treated by a physiotherapist. And if you're not giving a correct treatment, or if you're not able to identify the correct cause, then you will not be able to solve the problem. Okay, so the first type is extraurethral incontinence. So this is sometimes they will be having congenital abnormality. So other than the urethra opening, some people will have a opening in the suprapubic area, and they may have urinary leakage over through that hole. So that hole will not be able to control because it will not have the pelvic floor muscle to control the opening. So continuously they will be having leakage through the extra opening. So here, even though if you are giving more of pelvic floor exercises, it will not be able to control that particular thing. They have to undergo a surgical correction and they have to close the particular extraurethral opening, or they have to insert a bag throughout their life and it will be collected in the bag. So that is about the extraurethral opening. So as a PT, we don't have role in that in this particular type. The next is nocturnal enuresis. Nocturnal enuresis is during sleep they might go for incontinence. Okay, so the incontinence may be small drops or they may be like completely they may urinate. So this nocturnal enuresis is acceptable till the child is attaining certain age. Like for example, till 5 to 6 years they accept bedwetting. But after that also, if the child is having this bedwetting habit, then you need to check what is the issue. So they might have some psychological issues, like they might see some bad dreams and they might have some psychological pressure, so which may lead to bedwetting, or they might take a lot of fluids before bedtime and they will not be able to control the voiding. Okay, so after their voiding they will know that they have bedwetted. So with psychological counseling you will be able to bring up the child to the normal thing. Okay, so here also as a PT we don't have much of role. The next is giggle incontinence. So giggle incontinence means they may have urinary leakage whenever they laugh. So whenever they laugh, the intra-abdominal pressure will increase and this may lead to leakage of the urine. Okay, so this is called as giggle incontinence. So here the leakage is because of pelvic floor muscle weakness, because whenever they have the intra-abdominal pressure, the pelvic floor muscle have to contract and hold it tight. But maybe if the position is not proper, or maybe the pelvic floor muscle is weaker, they will not be able to hold it. So this will lead to incontinence. So here you will be able to treat them by giving pelvic floor muscle exercises. The next is incontinence associated with sexual activity. Sometimes during their sexual activity, they might have little bit of incontinence. So this is normal to have because the vagina and the bladder is very much closely approximated. Whatever pressure applied to the vagina will be transmitted to the bladder, and this might cause contraction of the dextrose muscle and lead to leakage of the urine, because during intercourse they need to keep the pelvic floor muscle relaxed, so they will not be able to control the urine. So here uh, what you can do is like you can advise them to void before going for sexual activity. So this will help them to reduce this particular problem. Here, even if you are giving a good pelvic floor muscle strengthening exercise also, it will not help them, because the sexual activity will keep the muscle relaxed. And for incontinence, you need to contract the muscle. So both will not be able to dance at the same time. So you need to ask them to void before the activity. The next is functional incontinence. So functional incontinence is functional disability. So the person will have functionally they will not be able to get up and walk to the restroom because of knee pain, because of joint pain, because of arthritis, or because of any other thing. So that's why they might lead to this incontinence. So for this, like, we need to cure them functionally. So we need to make them to uh, mobilize the joint, reduce the joint pain, and make them to walk and mobilize them so that they are able to reach the restroom. Then mixed urinary incontinence is the complaint is mixed together. So it may be any stress, or it may be any other, all the reasons mixed together is called as mixed urinary incontinence. Next is stress incontinence. So stress incontinence is because of increase in the intra-abdominal pressure, the bladder will immediately undergo contraction, and the pelvic floor muscle will not be stronger enough to control the urine. So this is called as stress incontinence. So major of the problem is because of the weakness in the pelvic floor muscle. So as a PT, we have to treat the stress incontinence more compared to other types. This stress incontinence will be in our here the stress incontinence is in our control. So we need to, if we give a good pelvic floor muscle strengthening, we will be able to solve this problem. So even though if they have many in types of incontinence, these are the four types which are majorly affecting the population. So these are the wide prevalent types of incontinence. One is overflow, then stress, then urge, and functional. Overflow was the bladder may be like keep on filling and it is overflowing. So the if the person has any pathology inside the bladder like tumor or any bulge or anything, so the bladder capacity will reduce. So even though if it is like lesser amount of collection also, they will the bladder will be full, and it will be in they will be having the incontinence. So that is called as overflow incontinence. Then stress incontinence is due to weakness of the pelvic floor muscle. The weakness of the pelvic floor muscle may be because of continuous coughing, sneezing, there is increase in the intra-abdominal pressure, pregnancy, all that will lead to the stress incontinence. Okay, next is urge incontinence is when they will be having a first urge. So by the time they reach the toilet, they will void. So this they will not have the proper three-level control. So that is called as urge incontinence. So functional incontinence is because they are not able to walk to the restroom, they might have the incontinence. Okay, so in all the major things, we will be concentrating more in the stress incontinence. So stress incontinence is nothing but uncontrolled leakage of urine during physical exertion, such as coughing, sneezing, laughing, or performing exercise. So when the thing if there is any increase in the intra-abdominal pressure, the pressure exerted will not be able to control the urine. They will have the incontinence. Okay, so this is majorly because of weakness of the pelvic floor muscle, and this will be more affected or more common in the women compared to men. So you can see here in the picture, this is a normal pelvic anatomy. So where whatever pressure is exerted over the pelvis, over the bladder, immediately there will be counter pressure from the pelvic floor muscle. Okay, so whenever there is pressure over the bladder, there will be counter pressure or counter compression of the pelvic floor muscle, so that there is no leakage. Okay, so the urethra will be completely closed. But whenever there is weakness of the pelvic floor muscle, you can see whenever there is a pressure, the pelvic floor muscle will not be able to close the urethra. So it will just leave it. So there will be some leakage of the urine. So this is the stress incontinence. So when we improve this particular muscle power, then we will be able to control this stress incontinence. Is that clear? So the major cause of the stress incontinence is weakness of the pelvic floor muscle. So you can see here, whenever there is pressure, automatically there will be counter pressure over the pelvic floor muscle. 1 minute. Yes, Prof. Good morning, Prof.
You join this one, huh?
I will join, sir. I will finish off the class in 2-3 minutes, then I will join it.
Okay.
Okay, sir. Thank you, sir. Okay, so here majorly if you see whatever pressure is there over the bladder, if the pelvic floor muscle is stronger, then it will give a counter pressure and close the opening. But when there is a weakness in the pelvic floor muscle, automatically the gap will be opened up and they will have leakage. Okay, so this is the stress incontinence thing. So if we control, if we improve the muscle power, then we will be able to solve the problem. But before that, we need to know what are the other factors that is affecting this muscle, and why women is more affected about the stress incontinence and how to do the exercise. I think we will continue in the next class. Okay, so you have 2 more weeks to go, isn't it? 20th will be your last day, isn't it? Okay, so we need another 2 hours to complete this particular chapter. Then after that, we will have revision for at least 2 hours or 3 hours. So maximum we will try to finish it on 16th. After that, you will be free. Okay, so most probably we'll try to finish it by 11th. That is Monday and Wednesday class. If not, I will take 1 hour on next like 16th. Is that clear? Okay, so you please check, anybody please check in the LMS, and if the slides or anything is because I just imported the videos from the previous session. Okay, so when I imported from the videos, the slides also got changed, so that's why there was some confusion. I have rechecked everything. You just check the LMS, and if I want to upload any other, you just let me know. Okay, so is that clear? So thank you all. Please be ready before next like before 12th, for before 11th for the tutorials. So you need to at least read the slides once so that we can clear your doubts. Okay, thank you.